but you also mentioned emotional issues, things like depression. How does something like biomagnetism, which seems to work on just terrain or, restoring certain pH, how does it work on those issues, the psycho-emotional side?
Well, in part of our muscle testing, the we do scan for emotions as well. So the idea there is to label them, and then there's also a pairing associated with that. So yeah, we definitely do go into emotional things. There's a difference. Depression. There's clinical depression, and then there's depression because some kind of life event. And so either way, if we restore your biochemistry, people do feel better. I mean, if there's a endocrine system problem, well, things shift, and there we go. We're back to normal, if you will. And of course, the other things when people lose. I mean, this whole past year has been terrible for a lot of people who've lost loved ones, or people can't see each other. So in my experience, I think I need to go a little bit deeper. And that's I think it's so valuable that I even studied holistic health at the university, because there's this whole thing about active listening and just giving people strategies. But and that was the whole point to that recalibration system, is to help people have a system, a protocol, steps to submit themselves to, and just see that the beautiful thing, not be afraid about feeling. I mean, I think a lot of people want to avoid pain and sadness at all costs, and I think that's a failed strategy. I think we have to look at it and validate those feelings, and otherwise we're just a friend of mine called it this: it's you're spiritually bypassing, where you go from like, oh no, I'm fine. No, you're not fine. So we have to be careful about that. And I do try to show people, even if people don't have the kits or the magnets, I still say, hey, take this idea home with you, apply it to your life, and see what happens. It's simplified my life, that's for sure.
Yeah, it's so essential too to have that mentality and address things as they come up, because symptoms are just, bells basically going off showing something is there. And symptoms aren't just physical, they are completely emotional, spiritual. And I feel a lot of people have been stuck in on that spiritual because that's the hardest one to kind of identify. You don't have any lab reports for the spiritual ones, and that loss of purpose and that kind of loss of feeling connected can really trickle down into the biochemical, and then you're looking for a biochemical source, but it's really the spiritual side of it. So it's really important to address all three, and it's wonderful how biomagnetics can help you get there.